Assalamualaikum and very good day to my beloved lecturer Dr. Muhammad Farhan Abdul Wahab and fellow friends. So now we are going to tell about motor neuron disease. So this is our group member.
We will begin with the introduction. So the first one is illness and death. Mokhtar began having throat problems and went to the hospital to finding out what the problem was. Doctors diagnosed him as having motor neuron disease with the discovery only being told to him and his wife. He then went to the London with his wife in an attempt to cure his condition. After 3 years battling the disease and his condition worsening, Mokhtar died at the Subang Jaya Medical Center on 11 of July 1991. So what is motor neuron disease? Motor neuron disease is a rare condition that progressively damages parts of the nervous system. This leads to muscle weakness, often with visible wasting. MND happens when specialist nerve cell in the brain and spinal cord called motor neurons stop working properly and die prematurely. This is known as neurodegeneration. So there are several types of motor neuron disease. So first one is amyotrophic lateral sclerosis, which is ALS. And second one is primary lateral sclerosis, which is PLS. The third one is progressive bulbar palsy, PBP. And the fourth one is progressive muscle atrophy, and also the last one is variant flail arm or flail leg.
Okay, next I will be talking about the MND symptoms. The different types of MND can cause similar symptoms, and the specific symptoms depend on the type of MND and the area of the body it affects. MND have three stage, which is early, middle, and advanced. In the early stage of MND, symptoms develop slowly and can resemble those of other health conditions. Typical symptoms begin in one of the following areas, such as the arms and legs, the mouth, or it could be at the respiratory system. The symptoms or sign of the early stage is weakness of the muscle, especially in the arms and legs. For instance, weakening in grip, which makes it hard to pick up and hold things. Muscle can lead to pains, cramps, and twitches too. After that, it could lead to slur in speech and difficulty in swallowing at the part of the mouth. And for the part of the respiratory system, it could lead to shortness of breath. Lastly, we can notice that the loss of the weight as the muscle lose their mass. Okay, next, the early symptoms become more severe, which is it moves to the next stage, which is middle stage. For the middle stage signs, the muscle becomes shrinkage and it lead to difficulty in moving. Next, it causes drooling, which is due to the problem with swallowing. Thirdly, it uncontrollable of the yawn, which can lead to jaw pain and difficulty in breathing. We also can notice by the changes in personality and emotional states. Okay, lastly, the stage of the MND, which is advanced stage. Advanced stage signs and symptoms where all the muscles are paralyzed and by that they need help in doing the mechanism of action such as moving, eating, and breathing. This disease become life-threatening and breathing problems, and the most common can cause to death.
Hi, my name is Elisha Shakira binti Pia from AS12030. We'll discuss with you about the day Treatment MND. There is currently no cure for MND. However, there are many ways to listen how it affects person's day-to-day activities. Some individuals have the illness for a long time. Treatment construct assisted reliefs, delay the disease course, and increase patient independence and comforts. This could including using breathing, nutrition, movement, and communication tools, and applies physical communication and speech therapies are all possible in rehabilitation. Treatment will include highly specific clinics, usually with a cooperation therapist and a trained nurse, to make routine jobs simple. Next, we have some exercise and physical therapy to prevent stretch and reduce stiffness. Thirdly, we can get some information about diet and eating from a dietitian and a speech language from psychologists. Lastly, treatment for MND is Relaxo, a medication that can moderately reduce the evolution of the ailment, as well as medicine to ease muscular stiffness and treat salivary issues. Thank you.
What's wrong with Datuk Mokhtar Dahari and MND? Prolonged and intense physical may raise oxidative stress effect on cell health, including neuron. An imbalance between free radicals and the body's capacity to counteract them with antioxidants lead to oxidative stress. This imbalance may have a role in the development of some neurodegenerative disease as well as cellular damage. The role of traumatic brain injuries or head trauma, which can occur in contact sports or activity involving repetitive impacts, and their potential links to neurological conditions.